Now, there's a specific issue about trying to get a moderate opposition in Syria that can serve as a partner with us on the ground. That's always been the hardest piece of business to get done. There are a lot of opposition groups in Syria along a spectrum from radical jihadists who are our enemies to folks who believe in inclusive democracy. And everything in between. They fight among each other. They are fighting the regime. And what we're trying to do is to find a core group that we can work with, that we have confidence in. That we vetted, that can help in regaining territory from ISIL, and then ultimately serve as a responsible party to sit at the table in eventual political negotiations that are probably some ways off in the future. That's always been difficult. As you know, one of the debates has consistently been should the Obama administration provide more support to the opposition? Could that have averted some of the problems that are taking place in Syria? And as I've said before, part of the challenge is it's a messy situation. This is not a situation where we have one single unified, broad-based, effective, reliable question, the idea that maybe we have to have President Obama, let me answer the question, Ed. And so what we are going to continue to test is can we get a more stable, effective, cohesive, moderate opposition? But that's not the sole measure of whether we are winning or not. Remember, our first focus, ed., here is to drive ISIL out of Iraq. And what we're doing in Syria is, first and foremost, in service of reducing ISIL's capacity to resupply and send troops. And then run back over the Syrian border to eventually re-establish a border between Iraq and Syria so that slowly Iraq regains control of its security and its territory. That is our number one mission. That is our number one focus. There are aspects of what's going on in Syria that we've got to deal with in order to reduce the scope of ISIL's operations. So, for example, our support for Kurds in Kobani. Where they've been able to hold off ISIL and where we've been able to effectively strike ISIL positions. Consistently, that's not just because we're trying to solve a Syria problem. That's also because it gives us an opportunity to further weaken ISIL so that we can meet our number one mission, which is Iraq. In terms of things to do differently, I guess, Ed. The question you're asking is one actually I think I have answered. If you're asking about personnel, or if you're asking about position on issues. Or what have you, then it's probably premature because I want to hear what. Question, your leadership. Is there something about your leadership? President Obama, Ed, what I'd like to do is to hear from the Republicans to find out what it is that they would like to see happen. and what I'm committing to is making sure that I am open to working with them on the issues where they think that there's going to be cooperation. Now, that isn't a change, because I've suggested to them before that where they think there's areas of cooperation, I'd like to see us get some things done. But the fact that they now control both chambers of Congress I think means that perhaps they have more confidence that they can pass their agenda and get a bill on my desk. It means that negotiations end up perhaps being a little more real because they have larger majorities. For example, in the House, and they may be able to get some things through their caucuses that they couldn't before. But the bottom line that the American people want to know, and that I'm going to repeat here today, is that my number one goal, because I'm not running again, I'm not on the ballot, I don't have any further political aspirations. My number one goal is just to deliver as much as I can for the American people in these last 2 years. And wherever I see an opportunity, no matter how large or how small, to make it a little bit easier for a kid to go to college, make it a little more likely that somebody is finding a good paying job, make it a little more likely that somebody has high quality health care even if I'm not getting a whole loaf. I'm interested in getting whatever legislation we can get. Past that adds up to improved prospects and an improved future for the American people. Sam Stein. Question, thank you, Mr. President. Following the elections. Congressional Republicans are pushing once again for major reforms to your Health Care Act. In the past, you've said you're open to good ideas but you don't want to undermine the bill. Can you tell us what specific ideas you're ruling out? Have the election results changed your calculus on reforming the law? And how confident are you heading into the second enrollment period? And on a totally unrelated matter, have you settled on a nominee? To replace Attorney General Eric Holder, and if so, who is it? President Obama, you guys want to spread out your news a little bit, don't you? You don't want it all in just one big bang. On the Attorney General, we have a number of outstanding candidates who we're taking a look at now. And in due course I will have an announcement. And you'll be there, Sam, when that's announced. But I'm confident that we'll find somebody who is well qualified, will elicit the confidence of the American people. Will uphold their constitutional obligations and rule of law, and will get confirmed by the Senate. On healthcare, there are certainly some lines I'm going to draw. Repeal of the law I won't sign. Efforts that would take away healthcare from the 10 million. People who now have it and the millions more who are eligible to get it we're not going to support. In some cases there may be recommendations that Republicans have for changes that would undermine the structure of the law, and I'll be very honest with them about that and say, look, the law doesn't work if you pull out that piece or that piece. On the other hand, what I have said is there's no law that's ever been passed that is perfect. And given the contentious nature in which it was passed in the first place, there are places where if I were just drafting a bill on our own, we would have made those changes back then. And certainly as we've been implementing, there are some other areas where we think we can do even better. So if, in fact, one of the items on Mitch McConnell's agenda and John Boehner's agenda is to make responsible changes to the Affordable Care Act to make it work better, I'm going to be very open and receptive to hearing those ideas. But what I will remind them is that despite all the contention, we now know that the law works. You've got millions of people who have health insurance who didn't have it before. You've got states that have expanded Medicaid to folks who did not have it before. Including Republican governors who've concluded this is a good deal for their state. And despite some of the previous predictions, even as we've enrolled more people into the Affordable Care Act and given more people the security of health insurance, health care inflation has gone down every single year since the law passed. So that we now have the lowest increase in health care costs in 50 years. Which is saving us about $180 billion in reduced overall costs to the federal government in the Medicare program. So we are, I think, really proud of the work that's been done. But there's no doubt that there are areas where we can improve it. So I'll look forward to see what list they've got of improvements. Question: is the individual mandate one of those lines you can't cross? President Obama: the individual mandate is a line I can't cross because the concept, borrowed from Massachusetts. from a law instituted by a former opponent of mine, Mitt Romney. Understood that if you're providing health insurance to people through the private marketplace, then you've got to make sure that people can't game the system and just wait until they get sick before they go try to buy health insurance. You can't ensure that people with pre-existing conditions can get health insurance unless you also say, while you're healthy, before you need it, you've got to get health insurance. And obviously, there are hardship exemptions. We understand that there are some folks who, even with the generous subsidies that have been provided, still can't afford it. But that's a central component of the law. In terms of enrollment, we'll do some additional announcements about that in the days to come. Starting in the middle of this month, people can sign up again. I think there are a number of people who the first time around said, on the sidelines in part because of our screw UPS on healthcare.gov. That's one area, Ed, by the way, that's very particular. We're really making sure the website works super well before the next open enrollment period. We're double and triple checking it. And so I think a lot of people who maybe initially thought we're not sure how this works, let's wait and see, they're going to have an opportunity now to sign up. And what's been terrific is to see how more private insurers have come into the marketplace so that there's greater competition in more markets all around the country. The premiums that have come in that are available to people and the choices. that are available are better than a lot of people I think had predicted.